Did you know that your nails, skin, and even strange food cravings can reveal signs of iron deficiency? And surprisingly, iron deficiency is sometimes the first clue that leads doctors to discover serious conditions like colon cancer. Today, you're going to learn the top 14 warning signs of iron deficiency so you can recognize them early. Because noticing these clues early could protect your health or even save your life. Let's start with one of the most classic signs. Pale skin, pallor. Pallor simply means your skin or mucous membranes look paler than usual. Here's why this happens. Your red blood cells contain a protein called hemoglobin. Hemoglobin gives blood its red color and allows it to carry oxygen throughout your body. Iron sits at the center of the hemoglobin molecule and acts as the binding site for oxygen. So when your iron levels drop, your red blood cells contain less hemoglobin. They become paler and less effective, which literally changes the color of your blood. You may notice this by checking the inside of your lower eyelid. Pull your lower eyelid down gently and look at the inner lining. Normally, it should appear rich pink or red. If it looks pale or almost white, it could indicate anemia. Another place to check is the creases of your palm. Normally, these lines appear darker than the surrounding skin. If the creases look very pale or difficult to see, that may also suggest anemia. Fatigue and shortness of breath, low hemoglobin, means less oxygen reaching your organs. When your tissues don't receive enough oxygen, your body struggles to produce energy. That's why even simple activities like walking upstairs or carrying groceries may leave you tired or short of breath. Some people also notice their heart beating faster because the body tries to pump blood more quickly to compensate. Spoon-shaped nails, koilonychia. Take a look at your fingernails from the side. In some people with iron deficiency, nails become thin and concave, forming a shape similar to a spoon. This condition is called koilonychia. You can try a simple test at home. Place a drop of water on your nail. Healthy nails usually cause the water to roll off. But if the drop stays pooled in the center, the nail may be spoon-shaped. Strange food cravings, pica. One of the most unusual signs of iron deficiency is pica. This means craving things that aren't actually food. A common example is chewing ice, known as pagophagia. Other cravings may include chalk, cornstarch, dirt, raw pasta, baby powder. If you suddenly develop strong cravings for ice, it's worth checking your iron levels. Smooth or burning tongue. A healthy tongue has many tiny bumps called papillae. With iron deficiency, these bumps can gradually disappear. The tongue becomes smooth, shiny, and sometimes painful. Some people describe a burning sensation or changes in taste. The tongue is often one of the first places nutritional deficiencies appear, because its surface constantly renews itself. Without enough iron, the body struggles to repair those cells. Red urine after eating beets. Beets contain a natural red pigment called betanin. Normally, iron helps break this pigment down, but in people with iron deficiency, betanin may pass through the body unchanged, causing pink or red urine after eating beets. This effect is called beturia. It occurs in about 10% of healthy people, but up to 80% of people with iron deficiency. Cracks at the corners of the mouth. This condition is called angular cheilitis. The corners of the mouth become dry, cracked, inflamed, and sometimes infected. These areas are especially sensitive because they constantly move while talking, eating, and smiling. Without enough iron, the skin struggles to repair itself, leading to repeated irritation. Frequent infections. Iron also plays an important role in your immune system. Without enough iron, immune cells cannot function properly. This can make you more vulnerable to infections such as fungal infections like ringworm, skin infections, respiratory infections. Your immune system essentially becomes less effective at fighting microbes. Restless leg syndrome. Restless leg syndrome causes a strong urge to move your legs, especially at night. It can make it difficult to fall asleep or stay asleep. Iron is essential for brain function, particularly for regulating dopamine. Low iron levels in the brain are strongly linked to restless leg symptoms. Studies show that many people improve when their iron levels are corrected. Mood changes and depression. Iron is not just important for blood, it's also vital for the brain. The brain needs iron to produce neurotransmitters like dopamine, serotonin. These chemicals regulate mood, motivation, and focus. Low iron can contribute to symptoms such as depression, brain fog, poor concentration. 11. Increased risk of blood clots. Iron deficiency can sometimes lead to high platelet counts, a condition called thrombocytosis. Platelets help blood clot. But when there are too many platelets, blood may clot more easily than it should. In rare cases, this can increase the risk of stroke. Itchy skin. Chronic itching without a rash can sometimes be related to iron deficiency. Low iron may affect nerve sensitivity and skin hydration. This can lead to persistent itching. Hair thinning. Hair follicles are among the fastest growing cells in the body. They require a steady supply of nutrients, including iron. Low iron levels may push hair follicles out of the growth phase, causing hair thinning or shedding. Dark circles under the eyes. Iron deficiency can make the skin paler and thinner. This allows the veins beneath the skin to become more visible. As a result, dark circles under the eyes may become more noticeable. How iron deficiency is diagnosed. If you suspect iron deficiency, doctors usually check a blood test called ferritin. Ferritin measures the body's stored iron. Low ferritin is one of the earliest indicators of iron deficiency. Sometimes an iron panel is also ordered to better understand how the body is storing and using iron. Why iron deficiency happens. There are three main causes. 1. Increased demand. For example, pregnancy, rapid growth. 2. Poor intake or absorption. This may happen with low iron diets, digestive disorders, celiac disease, Crohn's disease, gastric bypass surgery. 3. Blood loss. Common causes include heavy menstrual bleeding, surgery, gastrointestinal bleeding. Sometimes the bleeding source isn't obvious. In some cases, iron deficiency may be the first sign of colon cancer, which slowly bleeds over time. That's why iron deficiency should never be ignored. Tips to improve iron absorption. If you're trying to boost your iron levels, eat vitamin C foods, like oranges or bell peppers, with iron-rich meals. Avoid tea or coffee when taking iron. Separate calcium supplements from iron. Consider cooking with cast iron cookware. These small changes can help your body absorb iron more effectively. Final message. Your body often gives small warning signs long before serious problems develop. Pale skin, strange cravings, fatigue, or nail changes may seem minor, but they could signal iron deficiency. And catching iron deficiency early can sometimes reveal serious conditions before they become dangerous. Stay curious about your health. Listen to what your body is telling you, and take action when something doesn't feel right.